Emily, welcome. Thank you so much for joining us today.
Thanks, Candace. I'm really happy to be here today. So my name, as Julie said, is Emily Bryant, although my students call me Dr. Bryant. In practice, I would say everybody calls me Emily, but at school, it's a little bit different. I am also an assistant professor of pharmacy practice at Concordia School of Pharmacy, so that's in Mequon. And I'm just going to be, spending a little bit of time today with you guys talking about careers in pharmacy and then just pharmacy in general. Let's see here, and my career and how I got here. So this is actually not me. I had a picture of myself on the slide for a different setting and it just seemed kind of boring. So instead I put this picture. This is my son, Archer. He's 2.5, reading a really fun book with my sister. It's called Organic Chemistry for Babies. So if that tells you anything about pharmacists, we tend to be maybe a little bit nerdy, but I think it's fun. And it's actually a great children's book. And there's a whole series of these like science and career themed books. So I do not get paid or sponsored or anything. It's just really fun. So side note, there's that. But as I already said, I teach at a school of pharmacy. So I actually teach in Pharmacotherapy 5 for the pharmacy students. And I also teach in the experiential series. So I have a course that focuses on careers in pharmacy and finding your career pathway. So this is something that's really fun and exciting for me personally. So I really enjoy helping current pharmacy students and then prospective students kind of figure out what their career path is, whether that would be in pharmacy or not. And actually another fun fact, my sister, my youngest sister, not the one in the picture, just graduated from pharmacy school this last weekend. So that was really fun and exciting. And I swear I told her about careers other than pharmacy, and somehow she decided that pharmacy was great on her own. But regardless, we also have a number of specialized curricular tracks at the School of Pharmacy for students who kind of already know what they want to do after they get out of pharmacy school. And one of those things is potentially pursuing pharmacy residency. So I actually also coordinate the residency pathway. And so we can maybe talk a little bit about that later, but I think that's, longer, further down the road, but just so you guys know like what my role is at the school, that's something else that I do. And that's not all. I promise I have a life outside of work. Like I said, I have a 2.5-year-old son. I also have 10-month-old twins, so I'm pretty busy. And then I, like to cook, spend time with my family, play games. I have a cat and then also a dog, Cavalier, King Charles, if anybody else likes them. They're really fantastic, sweet dogs. So I just wanted to go through a little bit more information about where pharmacists work and like what type of jobs are out there in pharmacy. So this is very high level. What you guys are probably most familiar with, and the only thing that I was familiar with when I first got into pharmacy is actually like community outpatient pharmacy. So kind of your like Walgreens, CVS, right? And there's a lot more than what's on this slide, but this is probably like the most important things for you to understand that are out there, and also to explain like what I do and where I work. So I just assumed that I was always graduated and work at a community pharmacy, but I just wanted to break this down really broadly. So in all of these settings, pharmacists care for patients, and sometimes that's directly, working with patients, and sometimes it's more indirect. And so if you're looking at different settings, there's outpatient pharmacy, right? And outpatient pharmacy is basically caring for people out in the community. So that's why we commonly refer to that as community pharmacy. And that can either be at a chain pharmacy, so your CVS, your Walgreens, or it can be at an independently owned store. And that's definitely more common in like rural areas, northern Wisconsin, that people own privately owned pharmacies, right? And then it could also be at like a clinic type setting. So we call that ambulatory care. Just kind of different words for the same thing, but pharmacists do also work in clinics. And so sometimes they even, have appointments with patients. I actually work on the inpatient side. So inpatient means that you care for hospitalized patients. And so there's 2 different types of work that happens within the hospital. You can either work directly in central pharmacy. And so that central pharmacy is really where medications are dispensed and prepared. And then there's also decentral work where you work outside of central pharmacy. So not in central, it's kind of in the name, but you may or may not have known that pharmacists, even work in a hospital at all, caring for those hospitalized patients, or that, they maybe work out on a floor. So there's pharmacists that work in intensive care units, the ICU, in the emergency department, which I've also done at one point in my career. We'll talk about that later, or, in operating rooms, on patient care floors. So they work all over the hospital. So some of the centralized work tends to be like more like dispensing type role, and then decentral tends to be more clinical. So that's where the inpatient clinical pharmacist comes from in my job title, if that makes sense.
Can I ask you a quick question about that, Emily? With all those
Yes.
different options, Are there more opportunities kind of in one area or the other? Are there more opportunities to land a job in the outpatient setting or inpatient, or is it pretty equal?
It kind of just depends. I would say the areas that are growing more than others are actually those ambulatory type roles because those are kind of new, they're rapidly growing, and they've seen that there's really a value to having pharmacists manage medications in that setting. That's probably the most rapidly growing area where there's a lot of growth and opportunity right now. But things do trend, they change over time. One year it might be, there's a big bunch of closures or a merger or something happens in outpatient and then it's kind of the other way. Or I think also with so I work for Aurora Advocate, just disclaimer, but I think with the merger, there's also some talk about, building new hospitals. And so that creates job growth. So it just kind of depends like where and when, I guess. But so
Thank you.
I wanted to ask you guys, I kind of gave away a little bit of it, but I want to know what you already know about what does a pharmacist do, right? So I want you to just throw some stuff in the chat box. Tell me what it is that you think a pharmacist does.
All right, students will watch for those answers to come in. What is it you think a pharmacist does? Which this is great because one of our questions I know that comes in is what a pharmacist does on a day-to-day basis. So I think we'll be digging into this. So we have a classroom of students, pills, medicine, bottling medicine, awesome, doses,
Vaccine.
vaccines.
Great. Yeah, so I think one thing that I did kind of want to dispel this misconception that pharmacists count pills. So I think in some settings that is maybe the case if you have a smaller pharmacy, but most often it's actually a technician who's preparing the medications and counting the pills and even making IV medications. And actually we have this program, this is even well beyond, but there's a program at our hospital where we have tech check tech. So one tech will prepare it and one tech will check it. One tech will check it, excuse me. And then they can be specialty trained to even do chemotherapy and such. So most often the pharmacist is really checking for errors and making sure that things are dispensed correctly. So we definitely do deal with medication, but the physical preparation of medication is most often done by a technician. Pharmacists definitely are heavily involved in vaccine administration and preparation, especially this year more than ever with the COVID vaccine. See chemical reactions. So yeah, pharmacists can work in industry, which would be more where you deal with the chemical reaction side as well. So just in case nobody had ideas, I found this nice little summary image that gives a couple common tasks. So overseeing ordering, inventory management is a common thing that pharmacists have to do, whether it's inpatient or outpatient. We check for drug interactions. So we, while we don't prepare the medications, most often we need to review them. So we need to review what the doctor ordered makes sense. A lot of times we'll dose, adjust based on kidney function or maybe drug-drug interactions. And then not only do we need to make sure that the order makes sense, we need to check that what the technician prepared is what was ordered, right? So there's two levels that kind of go into that. And then a lot of what we do is teaching patients about medications, right? Counseling. And there's more than that, but these are just a couple high points, common things. Okay, so hopefully find this interesting. So it's hard to get real life images in a hospital because there's a lot of protection over patient information. So I don't have a real life picture of my floor. I would love to do that, but it always makes me super nervous. I honestly feel nervous taking out a phone or a camera or anything in the hospital because there's just a lot of sensitive things happening. So you never want to do anything that would potentially have confidential information, but this is really a real life unit in the hospital where I work. So it's not my floor and I'm not in the picture, but it is a floor in the hospital where I work. So if that gives you an idea that we're really, I mostly sit at a desk. I am literally sitting on the floor with all the nurses, providers around me, right? So I interact a lot with other professionals, and that includes physicians, physician's assistants, nurse practitioners. I work with occupational therapists. I work with physical therapists. I work with a dietitian heavily. So I actually work on a surgical floor. So there's a lot of, and a gastrointestinal surgical floor. So there's a lot of patients that need to have IV nutrition or injectable nutrition. We call that TPN. So I work a lot. His name is Cody on my floor, but among others. And I'm right in the middle of it all. And I think that's really cool. So just to give you an image of kind of what that looks like. Okay, so again, I've told you a lot of things that inpatient pharmacists do, but on the right, you'll see, I just wanted to break that down a little further and tell you specific examples of things that I do in my daily workflow. So this picture on the right is actually one of the robots. We have 3 robots in the central pharmacy where I work. I don't work in the central pharmacy, but at the hospital. These are big, right? They're big robots. This one's name is Bart. We name him after the Simpsons. So this is Bart, but this Bart helps dispense some of the pills. So the technicians mostly oversee the dispensing from Bart, and then otherwise in the preparation of injectable medications. And then the pharmacist would double check that. Obviously, there's a lot of management of inventory that goes into this as well. So the pharmacist mostly verifies that what the technicians did are correct, and that's IV, topical, inhaled, also chemotherapy, amongst others. And then as far as what I do, so I do a lot of dosing of medications. So I dose like blood thinners, so anticoagulation. I dose antibiotics, antiarrhythmic drugs, or heart medications. I actually make a lot of recommendations to change antibiotics based on cultures and things like that. I adjust medications based on kidney function. I monitor labs. So I actually have what's called collaborative practice agreements in order to do those dose adjustments and order labs that I might need in order to make those adjustments. And then I make a lot of recommendations to doctors to add, adjust, discontinue medications while the patients are in the hospital. And I can either page the doctors, but most often I just talk to them in person. And so I actually really love what Julie was talking about making connection, because I think in healthcare, if they know who you are, they put a name to the face. You know, we don't just talk about patients, we talk about our kids, we talk about life, we just talk about, like, you know, maybe you have a really busy day or what you're doing for the holidays or the weekend, but having connection makes it a lot easier for them to trust me and see me as a real person, not just like a robot that's saying, this dose isn't exactly what you know. So I think that's really, really practical suggestion. And I use that all the time. In fact, I just talked to my pharmacy resident the other day about, he's kind of like a quiet person and he's very much an introvert. And so I was talking about the importance of connection. So just take home point, that really is something that applies all the time in everyday work. And then I also attend codes. So codes are when a patient is not breathing or does not have a heartbeat. So real life threatening situations. And we would be the ones preparing the medications in those situations. The pharmacist would. So we're also specialty trained to do that and also assist with other interventions that you might need in those life-threatening situations. Did that a lot when I worked in the emergency department, sometimes multiple times a day. And then I also verify orders, or I don't at my site, but a lot of pharmacists in hospital verify orders, which means that they're like confirming that what the doctor ordered is appropriate. So I really love inpatient pharmacy because I'm constantly challenged. I like being, you know, excited and doing something different every day and being engaged. I hate just sitting there and being bored. That's not me. I really like that I get to see and care for patients with very different disease states and complicated stuff. And I like making a difference by interacting mostly with providers and sometimes with patients. So I think the main thing that I hear from students, the pharmacy students that are interested in working in outpatient pharmacy, is they want to be more directly working with patients, right? They love communicating with them and having a relationship with their patients. And I like mostly having a relationship with providers and then sometimes talking to patients.
Can I jump in really quickly again? I'm wondering how much of your day, so obviously you're full-time at Advocate Aurora, and then how many hours a week do you spend at the college teaching and things like that?
I apologize. I thought I muted to sneeze, but so yeah, I had a slide in here. I wasn't sure if you would want to know that information, but I work at the hospital 2 10-hour days. And then I work 3 days a week at the school. So when I'm at the hospital, I'm there from 7 a.m. to 5:30 p.m. So I am a 40-60, but it depends on who it is. So different faculty members have different percentages of practice that they spend in practice versus on campus. And then if you were a full-time pharmacist at my site, you would work 4 10-hour days is what they do.
Wonderful. Thank you.
Yeah. So I also want to know from you guys, you know, how much you already know about what it takes to be a pharmacist? Do you know how long you have to go to school? Is it an undergraduate program, a graduate program? So I kind of just want to know what your baseline understanding is so I don't have to rehash something you maybe already know. You just want to write that, yeah, and again in the chat. Thank you. Doctor of Pharmacy. Okay. That is true. So there's a number of different like professional doctor degrees. So obviously PhD is what people are most, like 12 years. It's not 12 years, although in theory it could be. And some people do take 12 years, but you can do it in 6. So you can do it in a minimum of 6 years. So that's 2 to 4 or more undergraduate or graduate coursework years. But the minimum again would be 2. It just kind of depends how fast you can get the minimum like requirements done for each school that you want to apply to. Some schools require different courses, and if you want to apply to a number of different schools that have different requirements, it might take you longer. And then some students also don't know they want to go to pharmacy school like immediately the minute they set their foot into that college door and start, and they might change their mind, so then it takes longer. So it's a minimum of 2, and then sometimes even it's like a second career. People come back to college or graduate school, or they do a master's first, so at least 2. You can do it in 6. I did actually graduate in 6. And then the pharmacy school itself is 4 years, so it's 3 years of classroom learning and then 1 year of rotations where you're actually like out at site. We call that experiential rotations. And that 4th year is called advanced pharmacy practice experience. So it's all spent on site learning. There's no classes or anything the 4th year. And then some schools do pharmacy school as like a 0 to 6, where you do the undergraduate coursework and you'd apply out of high school, and then you'd basically stay there the whole 6 years and do it directly. But most schools do it separately, where you do the undergraduate part and then you apply separately to pharmacy school. And then after you get done, you are required to take a licensure exam. So you do both a clinical like calculations exam called the NAPLEX, and then the MPJE, which is the law exam. Okay, so this is actually my career pathway, or I like to call it career trajectory, because most people's career pathways aren't linear, right? You don't immediately know exactly what you want to do, never change your mind, never take a side track anywhere else, right? So I prefer to call it trajectory versus a pathway, because I think it's appropriate and great to sometimes change your mind or find new things that you love. And that's sort of been the whole story of my career. Is I like everything is my problem. But I will say, I knew immediately in high school that I wanted to go to pharmacy. I didn't know what that looked like, and I definitely didn't really know what pharmacists did, but I knew that I wanted to go to pharmacy school, and I stuck with it. I actually grew up in Wisconsin, in Kewaskum. I don't know if you know where that is. It's like a little south and west of Sheboygan, if that's where you're located today. So I had a really nice high school teacher who suggested to me that I would go to that I should think about looking at pharmacy, because I liked science and math, which is what everyone always tells you, but I didn't want that. And I wanted to work in healthcare, but I didn't want the blood and gore. And I'll come back to the irony in that in a minute. So I did. And, I excelled academically, and I wanted to do that. And it was in theory a good fit. But my mom, who was a really smart woman, told me, hey, if this is what you want to do, like maybe you should try to go get experience in a pharmacy, get a job in a pharmacy to see if you really like it before you commit your whole life to doing this. And she was right. So I kind of looked all over town. I ended up getting a job as a tech at Shapco, which RIP, Shapco doesn't exist anymore, but I worked at Shapco in high school, and turns out, in good news, my instincts were right and I did stick with it, but I still thank my mom for having me do that. I think it was a great suggestion. And then I ended up applying to and going to the University of Wisconsin-Madison for my undergraduate coursework for 2 years. And then I went to pharmacy school at Concordia, which was actually a brand new school at that time. They were just opening the school of pharmacy. So I kind of took a chance on that. And it was a great chance that I took, a great choice. So I went there. And then when I was in my 4th year, I actually signed a contract with Walgreens, because that was where I was an intern at the time. And I went on my first rotation that 4th year, and I decided to change my whole life plan. My clinical instructor was like, hey, you should consider applying for residency and working in a hospital. And I was like, okay, that sounds great. It was very late in the game to do so, but I did. I ended up matching. And then after I did that 1st year residency, I stayed on and I worked at Aurora St. Luke's, which is where I practice now. And then a couple years after I was in practice, my boss emailed me while I was on a cruise and said, do you want to take over as lead emergency department pharmacist? Which was a big change for me and usually requires more training than I had. So it was a big leap of faith. And ultimately I said, sure, I'll do it. And I loved it. It was great. Did that for a couple years. And then what I've always wanted to do is teach. So I ended up coming back to Concordia as faculty. I still work at St. Luke's, just not in the emergency department anymore, because the combination of second shift and overlap just doesn't quite work and they need somebody full time to stay down there. But if that tells you a little bit about, I've kind of been all over the place. Eventually I ended up doing both things that I really love a lot, which is teaching and working in inpatient pharmacy.
I have a quick question, Emily. To do the inpatient side of things, do you have to do a residency to get those positions?
Great question. I think that's a common question that students have, and pharmacy students or prospective students. You do not have to. There are positions that are out there where you can work in a hospital without doing a residency. They're more common in rural areas at smaller hospitals. And I do have classmates that did not do a residency and do work in hospitals, but it definitely gives you a step up. Again, it's just another thing you can put on your we call them CVs, not resumes in pharmacy. So most of healthcare calls them CVs, but like a resume, and immediately kind of gives you a step up over the competition. But residency is really just kind of concentrated training, right? So it's certainly possible, but it's easier to get those positions if you have done a residency.
Great, thank you.
Yes, great question. So I think that was kind of along the lines of what I was going to say to you guys on this slide. It's busy, so you don't have to read all of this, but what I wanted to emphasize are kind of additional things that I've done beyond just the minimum requirements to be a pharmacist that specifically helped me get a job at the College of Pharmacy and then also in hospital. So I already sort of talked about residency briefly, so that's a competitive program. You have to apply and be matched just like physician residencies. There's first year residencies, which are generalized, and second year in specialized areas. And then I did a 1 year residency. There is a stipend, you do get paid, just not regular salary for those positions. And then another thing two things that I've done is get my board certification in pharmacotherapy, which is recommended but not required to work in a school pharmacy. And then I guess also a lot of the pharmacists that I work at my hospital also have board certification in certain specialties. But again, I think it's like most emphasized if you work in a really specialized area, like transplant or critical care or something like that. And then at my site, not every hospital, we are required to be advanced cardiac life support certified. So that is like BLS is basic CPR training. So a lot of people are BLS trained, but ACLS adds that you have been trained in medication administration in those life-threatening situations, and then also in respiratory support as well. And then there's other things on here about, that would maybe be good opportunities for teaching. So dual degrees or advanced degrees of other sorts. A lot of my colleagues at the school pharmacy have PhDs or MBAs or other degrees. And then teaching experience would probably be the main thing, right? Either formalized teaching certificates or training, or I had more like on the job teaching, training, working with students and pharmacy residents. So then the last piece I had here is kind of just to talk through what are things that you guys can do now to help set yourself up for success. If this sounds great and you say, hey, I want to go to pharmacy school, there's a couple different categories. I think the main one, I'll take a page from my mom's book here and say experience in healthcare. Healthcare is great in any way, but specifically pharmacy if you can. Either you can job shadow or trying to get a job, actual employment in a pharmacy. You do not need any sort of a degree. Some places you do need to be 18 or have a high school diploma, but not everywhere to work in a pharmacy as a technician. And then you usually can just take a certification exam at some point, and they'll usually support you through that on the job. But also, again, job shadowing is another way to do that. I've also met a ton of high school students who work as scribes, which I had never heard of before. So I'm just going to throw that out there. In like the emergency department, they don't write their own notes, right? Things move way too fast for that to happen. So they need someone to transcribe on the computer what's happening. And so they get to see everything that doctor's doing and go with them through every step of the way. That's a really cool job. They need a lot of them. The hours aren't always like, regular Monday through Friday. But if that's something that's interesting, look into scribing, because I think that's a really cool opportunity. In order to improve your application, I would say I'd emphasize working on optimizing your GPA, but especially your science GPA. A lot of colleges of pharmacy separately calculate that when they're looking at applications versus just your overall GPA. And then we really highly emphasize focusing on leadership and volunteering, because those are important skills and things that they'll look at when you apply to pharmacy school. And then as far as elective coursework that you could or should take, I would say everyone says science and math, right? If you like science and math, well, courses that would really help you both prepare for things that you need to take in pharmacy school, and then just the preparatory coursework that we take in order to apply to pharmacy school would be chemistry, bio, physics, maybe calculus, because you'll need to take those to get into pharmacy school anyway. So either you can get them out of the way if you are able to get college credit for them, or potentially, just get extra practice in those areas and really feel strong. So like I said, college credit is great if you have the opportunity either through advanced placement, AP, or if your high school happens to have a program with a college, and you're able to get college credit that way too. Those are great opportunities, and they can help kind of set you further along than other students, right, by already having some of that coursework done. So I just have to put in a little plug for Concordia School of Pharmacy. Again, I went to this School of Pharmacy, so it's very close to me. I work there now, but also I chose this school because I just immediately felt this sense of like community there. And so our tagline is that it's uncommon education, right? An uncommon pharmacy education. But I can honestly say that if you come visit, you will see that that's true. We really connect with our students. The picture on the right is from my white coat ceremony. So we were the first class ever to attend the School of Pharmacy. I still know all of those people. The picture on the right, and then the picture on the left is just other students that have passed through, but I know all of them by name because we really emphasize, again, that connection. So that's something that I would say sets us apart. And we also have consistently exceeded the national rate of matching for pharmacy residencies. So, with my position and my particular interests, that's exceptional to me. But I just wanted to emphasize a couple other things that we have, or opportunities that might be of interest to you as high school students. So for high school seniors, if you're accepted to Concordia, Wisconsin or Concordia, Ann Arbor, and you meet minimum GPA requirements, you apply an interview, you can actually essentially apply out of high school and then continue on into the pharmacy program as long as you meet those requirements. So that's a really exceptional opportunity. Not all schools offer early assurance pathways. So if you're interested, that would be something I would look into. And then we also offer a number of dual degree programs. So these would be mostly probably of interest for students that are motivated, because you're basically taking 2 degrees and you're doing it more rapidly, but you save money and time out of your life because you can get done with both those degrees faster. So we offer those in MPH, which is public health. We offer an MPD, so that's product development. We offer an MBA dual degree program for business. And then we also offer this 3+4. And so that's really for students that don't have a bachelor's when they come into pharmacy school. And then again, you can get the bachelor's while you're in pharmacy school and ultimately have both degrees. And then I just put a little fun stat out there about how Concordia stands out. The students scored 13% higher than the national average, that they said that if they were starting over again, they would choose the same school of pharmacy. And I hope that speaks to how great our school is. Our website down there if you want more information, and then that could help you get in contact with our admissions counselor, Kaylin. But you're also free to email me if you would like directly, or especially if you have questions about clinical pharmacy or hospital pharmacy. And then I also put a couple other websites on here that are focused on pharmacy careers. So Pharmacy for Me is great. This is just their screenshot of their page about a hospital pharmacist, but they go through all sorts of different careers in pharmacy, and also just generally information about, figuring out if pharmacy is the right career for you. So that's great. And then the other one is this Pharmacist Career Pathways program, which is something I teach in my pharmacy school course.
That is wonderful. It's funny because one of the questions our students ask the most is kind of like, how do I know if this is right for me? And there's literally a website for your students to find out if pharmacy is right for you. So students, we're going to be wrapping up here in just a minute. Or if there are any additional questions that you have for Dr. Bryant, please put those into the chat. We're going to be putting a survey in there as well in just a little bit. One last question that a student had submitted leading up to the session today. You've gone through so much great information about, what it's like in this career field and what you should do to give yourself a better shot at landing in this career field. What would you say are characteristics that are imperative to being successful as a pharmacist?
Sure. So I would say the number one thing is being detail oriented. I think there is definitely a stereotype, and it's true appropriately because your whole job as a pharmacist is to like find the areas, to nitpick everything else, right? So we tend to be very detail oriented, maybe a little bit too much so in some people's opinions, but that would definitely be one. And then I think, gosh, it just depends where you practice, but that would be one main one. I think that being like able to connect, as I said, is really so important anywhere, whether it be in a community pharmacy with your patients, with providers over the phone. So I think that having connection is also very important.
Wonderful. That is great feedback. Well, students, that survey is right there in the chat for you. Emily, thank you so much for joining us today and sharing all of this great information about this really interesting career field. Thank you so much.
Thanks for having me. It's been a pleasure.